Namaste Bitiya, Hamesha Khush Raho Bitiya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about Cor Pulmonale. This is the series of cardiovascular diseases, and in this series, we are going to discuss about the Cor Pulmonale today. Cor Pulmonale, it is also called as the pulmonary heart disease. What is Cor Pulmonale? It is defined as dilatation and hypertrophy of the right ventricle in response to the disease of pulmonary vasculature. So, what is Cor Pulmonale? It is the cardiac pathology that is developing due to the in response to the lungs, pulmonary vasculature pathology. So, it is also called as pulmonary heart disease, and it is defined as the dilatation and hypertrophy of the right ventricle in response to the diseases of pulmonary vasculature. It is right ventricular enlargement or the altered function that is resulting from primary lung disease. So it is resulting from the primary lung disease, and this leads to right ventricular hypertrophy and eventually to the right ventricular failure. This excludes congenital heart disease, in which there is right heart failure and it is secondary to the left-sided heart failure. I will again repeat this thing. It is a right ventricular enlargement or the altered function that is resulting from primary lung disease. It results from right ventricular hypertrophy and eventually to the right ventricular failure. This excludes congenital heart diseases. Congenital heart diseases are excluded in Cor Pulmonale, in which the right heart failure is secondary to the left-sided heart failure. All right. So what is the etiology? Etiology of Cor Pulmonale. The first etiology includes chronic obstructive pulmonary disease that can be emphysema or chronic bronchitis. So COPD can be the etiology. COPD you have already discussed in your third year. Cystic fibrosis, that can be an important cause for the development of Cor Pulmonale. Idiopathic interstitial pneumonitis can be the cause. Bronchiectasis can result into Cor Pulmonale. Pulmonary arterial hypertension can also result in the development of Cor Pulmonale, and chronic thromboembolic pulmonary hypertension, this can also lead to the development of Cor Pulmonale. So in etiology we have COPD, cystic fibrosis, idiopathic interstitial pneumonitis, we have bronchiectasis, we have pulmonary arterial hypertension, chronic thromboembolic pulmonary hypertension. Now, what are the clinical features? Clinical features will be divided into two parts, symptoms and signs. So first of all, let's discuss about the symptoms of Cor Pulmonale. In the symptoms, we have first dyspnea, that is the most common symptom of Cor Pulmonale. We will also, the patient will also experience cough and there will be fatigue. So dyspnea, cough, fatigue. The presence of sputum, and there is orthopnea and PND, that is most important sign. I hope you know about PND. This we have discussed already in the previous lecture, so I need not to repeat it again and again. The abdominal pain and ascites. We have dyspnea, cough, fatigue, sputum, orthopnea, PND, abdominal pain and ascites. Now we come to the signs. So in the signs, we have tachypnea, we have elevated jugular venous pressure, there will be hepatomegaly, lower extremities edema, right ventricular heave palpable along the left sternal border or in the epigastrium. We will also have cyanosis. So the clinical features includes the signs includes the tachypnea, elevated jugular venous pressure, there will be hepatomegaly, lower extremity edema, there will be right ventricular heave that is palpable along the left sternal border or in the epigastrium, and there will be cyanosis. Now, what will be the diagnosis? So, diagnosis, how will you diagnose the case of Cor Pulmonale? The diagnosis consists of chest X-ray that shows right ventricular and pulmonary artery enlargement. So, the chest X-ray will show us right ventricular and pulmonary artery enlargement. The spirometry and the lung volumes can identify the obstructive or restrictive defects. So, for identification of the obstructive and restrictive defects, we have to go for spirometry, and these will be indicative of parenchymal lung disease. Arterial blood gas analysis can demonstrate hypoxemia or hypercapnia. So we have chest X-rays, spirometry, and arterial blood gas analysis. The other diagnostic feature include two-dimensional echocardiography, that is 2D echo. It is useful in measuring right ventricular thickness and chamber dimensions. So 2D echo will be helpful for the measurement of right ventricular thickness and doing the chamber diagnosis. Doppler echocardiography to assess the pulmonary artery pressure. So we can do the Doppler echocardiography to assess for the pulmonary artery pressure. MRI can be done for assessing right ventricular structures and functions. So MRI can also be done. Now, how will you manage the case of Cor Pulmonale? So management consists of treatment of the underlying pulmonary disease. So first of all, we have to treat for the underlying pulmonary disease that is prevalent in that particular patient. We have to give adequate oxygenation to the patient. We have to give proper oxygen. We have to transfuse the blood if required. So transfusion in the case of anemic patient can be done. Diuretics are effective. Digoxin can be given, and pulmonary vasodilators are useful. So the management consists of treatment of the underlying cause, pulmonary disease, adequate oxygenation, transfusion in the anemic patients. Diuretics are effective. Digoxin and pulmonary vasodilators are useful in the treatment of Cor Pulmonale. So this was all about Cor Pulmonale. In the next lecture, we will be discussing about the various heart sounds. So this session was powered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.